Miss Roseanne. I'm going to be your nurse practitioner. What brings you in today?
Hi, my knee's been really bothering me. I think I've worked it out too much. I recently was diagnosed with osteoarthritis and I had fluid in it before and I think maybe it might be back.
I'm so sorry to hear that. Let me ask you a few questions before I do a knee exam. How long ago were you diagnosed?
I think that was maybe 2 years ago.
Are you able to walk? Do you have any problem with your gait?
I didn't, not really noticing too much problem with my gait, but there's like occasionally some puffiness, swelling, and I guess a little bit of pain too.
Okay. Well, in order to see if you have fluid, we need to do a focus knee exam. So do we have your consent to do a focus knee exam?
Yeah, I consent to that.
Before I do your knee exam, let me first do hand hygiene. Hand hygiene is very important before an exam. We'll start with the knee exam. Okay, so I'll have you supine, meaning laying flat on your suprapatellar pouch and gently pushing downward. This test is the Ballotman test. It's positive. It's a test to see if you have any joint effusion, or meaning that there's any liquid in your knee. Okay, so I'm gonna be right here, gently downward. Okay, well, unfortunately, you are positive for the Ballotman test. The patella did float. We will be doing another test. That test is called the bulge test.
Oh, what's the bulge test?
Great question. The bulge test is another test to rule out for any effusion of the knee. I will be stroking
Okay, that's fine.
the medial side of the aspect of the knee joint upward and then sweeping on the other side laterally. So if there's any effusion, there will be a bulge. Unfortunately, you are also positive for the bulge test, meaning that both your Ballotman test and your bulge test showed positive, meaning you do have fluid in your knee.
Oh, okay.
Okay, so the next thing we would have to do is we'll be needing to do a knee arthrocentesis. And basically it's inserting a needle 1 centimeter above and lateral to the superior lateral aspect of the patella at 45-degree angle. We will make sure to pre-medicate you, of course, with 1% in several areas of the knee. And what to expect post-procedure. There will be some soreness and tenderness as to be expected. I will be putting an ACE wrap on you just to put pressure on that knee. And the next 48 hours is very crucial. Do you know why?
Why?
Well, because it could be signs for infection. And so I want to make sure you know that if you have any fever, shortness of breath, or you feel like something feels off about your knee, please call me immediately or go to the nearest ER.
Okay, I understand. I'll make sure to monitor my signs and symptoms for the next 48 hours.
Perfect. Also, I will be prescribing you some ibuprofen for pain management as well.
Okay.
All right. And is there any other questions that you have for me?
No, I think I'm good. I consent to the procedure.
Okay, sounds good. Let me get the procedure right here. And if you can sign.
Yes, of course. Okay, I consent to the knee exam. I understand. Right, here you go.
Thank you. I'll be marking the site of where we will be putting, doing the arthrocentesis, okay? So like I said, it's 1 centimeter above and lateral to the superior lateral aspect of the patella at 45 degrees. And my initial. All right. We'll prep that site now.
Okay.
Perfect. Any other questions before we give you lidocaine?
No, I'm ready.
Are you allergic to any medications such as lidocaine?
No, I don't have a history of allergies.
Perfect. Have you had this done before?
Yeah, I have.
Okay, perfect. So you know what to expect.
Yeah.